Okay, well, welcome everybody to this Australian Reproducibility Network and Australian Equated Network Centre webinar on reporting, writing and reviewing articles and also the use of reporting guidelines. My name's Tammy Hoffmann. I'm a professor at the Institute of Evidence-Based Healthcare at Bond University on the Gold Coast in Australia, and also the director of the Australasian Equator Network. I've got the job of host this afternoon and introducing the overall aims of the webinar and who will be speaking to each of those. So first up, we've got Professor Paul Glasziou, who's going to talk about how to write the key sections of a research article efficiently and effectively. Then we move on to Dr. Matt Page, who's going to talk about the use of reporting guidelines and how they can help you with the writing, the publication, and improving the impact of your research. And in particular, Matt is the lead author of the PRISMA 2020 statement. So he'll be stepping you through elements of that. And then Professor Ginny Barbour, who's the editor of the MJA and a very experienced editor, she's going to talk about responding to and providing constructive peer review. That bit that we all hate is the responding to peer reviewers. She's got all the tips and tricks for how to do that. And then we'll have time at the end for further questions and answers. So each speaker is going to talk for about 20 to 25 minutes, including any questions that you've got. Please pop them in the chat as we go, and at the end of each of the presenters' sections, they'll have some time to respond to any questions in the chat, and then we've got that over a little bit more time at the end for the overall any other questions that come up that you'd like to ask. So we're very lucky to have all these highly experienced and internationally recognised experts in writing and editing and reporting guidelines with us. So I'm going to stop sharing and hand over to Paul, who's the first presenter.
Okay, thanks very much, Tammy. And I will attempt to share my screen. Is that coming up?
No, not yet.
No, I think I clicked into, there it is. Is that coming up?
Yes.
Does it say overview of the webinar?
It does.
Excellent. Excellent. So as Tammy said, I'm going to start by talking about the writing, the key sections of a research article and how you might go about trying to write that efficiently and effectively. I thought I'd begin though with a Slido. So if you go to slido.com and fill in that number or use the QR code. I'm going to do a couple of these. So this is a sort of just a first test one to go through. If everyone can get that up first of all. Oh, sorry. So I'll come back to that in a couple of slides, but if you just keep that open in your browser and then I'll use that. So what I'm going to talk about, as I said, is the key sections of a research article and how to write them efficiently and effectively. But I always like to set things in a bit of a historical context. So I want to take you back to 1665 to what is probably recognised as the first journal, which was the Philosophical Transactions of the Royal Society. So the Royal Society used to meet in London to share scientific findings at the sort of the beginning of the Renaissance. And the first editor of it was a guy called Henry Oldenburg. So journals have been around for several hundred years and interestingly have run into the sort of problems that we currently experience and recognise today. So some of you may have heard of von Leeuwenhoek, who was the first person that identified the little tiny animals that you can see under the microscope, things that we now think of as microorganisms like bacteria, etc. And he called them animalcules and wrote up a paper on this. And Oldenburg wrote back to him saying, can he acquaint us with his methods of observing that others may confirm such observations as these? So he didn't give sufficiently precise methods descriptions to enable anybody else to actually confirm his findings. And I mean, this was pretty extraordinary stuff, to say that there were these tiny invisible creatures. So as a journal editor, you wouldn't want to publish this without some sort of confirmation. Van Leeuwenhoek never actually gave that to Oldenburg, but instead Oldenburg got Hook in Oxford to replicate the findings, which took him some time. He had to experiment because he didn't have this precise method that Van Leeuwenhoek had used, but he eventually did manage to confirm the findings, and that's when Oldenburg decided to publish it. So you can think that the reproducibility crisis actually goes back to 1665 and has been just more identifiable in more recent years. An interesting thing is that until the last century, there wasn't a standard format of having the introduction, methods, results, and discussion sections in papers, which are pretty standard in at least medical journals now, but for most other scientific journals, sometimes with slightly different names in a varying order. But 1935 was really when that was first introduced. And here are the 4 major general medical journals and their degree of uptake of this. And it really took nearly a 40-year period for that to become a universal thing within those major general medical journals. So that was the sort of beginning, if you like, of a pretty standardized structure of the introduction, methods, results, and discussion. And Richard Smith, who's the ex-editor of the BMJ, used to talk about what goes into these sections. He said this is the wine glass model of a research paper, where you begin with the problem. Not usually that boring thing of how big the problem is, like, you know, it's so people always manage to spin it so it's the major problem, but just what the research problem is, the issue, and the story so far that then narrows down at the end of the introduction to what your question is. What is it you're going to answer? Then the methods section should have how we did this research precisely in a reproducible way. The results, what did we find? And then the discussion section usually begins with a sort of recapitulation of those main findings, not repetition of it, but a sort of summary of those main findings. And then the strengths and weaknesses, comparing it with the findings of others, and then what further research and conclusions might come out of that. So that's this so-called wine glass model. And that's now become more common in abstracts as well. So here's the abstract of a trial that has it in slightly different form. It talks about background, methods, results, and conclusions instead of introduction, the usual IMRAD. But again, that's a fairly recent phenomena that you see that sort of structure in abstracts. And it's not as far as Brian Haynes, who wanted a much more detailed abstract structure, had proposed back in the 1990s. Oh. So I'm going to talk about guidelines, but before I do that, here's our first Slido. I want to know about your experience so far with reporting guidelines. Starting at the top, you've actually used PRISMA. Matt will be very pleased, or CONSORT or STROBE. You've used another reporting guideline. I know about PRISMA, CONSORT or STROBE, but you've not used them. I've heard of reporting guidelines, but don't know them. And I don't even know about reporting guidelines. So can I get you to answer those? Oh, okay. I'll keep it up for just a moment longer. Okay, well, that's very pleasing that most, I think it's 3/4 of you have used PRISMA, CONSORT or STROBE. In other words, your experience with using guidelines. So I might go through that component of it more quickly and talk about how we can use the guidelines as scaffolding. Okay, a brief history. So I've mentioned that IMRAD was developed in the 1930s, Brian Haynes in 1987. proposed that we use an even more complex structure than IMRAD for the abstracts because the abstracts contain is what a lot of people would see, and so he wanted more detailed information. The first reporting guideline was CONSORT for clinical trials, and not until 1996, so it's a fairly recent development. But once it got there, the CONSORT statement was very widely used and then copied. So the Equator network that Tammy, Matt and I are part of now has over 300 reporting guidelines on its website. And on the top right-hand corner there, if you want to go to that, that's the Equator network website, which keeps a repository in Oxford of all of the reporting guidelines that they've identified that meet some minimum standards. But there are so many now, though, that they produce this list of the major guidelines like CONSORT, STROBE, PRISMA, SPIRIT, STAR-D, CARE, AGREE, etc., and also the extensions. So Tammy would be very fond for the randomised trials, at least, of the TIDIA extension, which she led, which talks about how to describe the intervention. So there's a whole series of extensions in addition to those key guidelines. So what goes in each IMRAD section? When I first learned about this was in a book by Day on how to write and publish a scientific paper, and I used it religiously to find out what goes in the introduction, what goes in the materials and methods section, how to write up the results, and how to write up the discussion. So there's two parts of it: what goes where and how should you report each one of them. So this was a sort of prelude, if you like, to all of the reporting guidelines. So in CONSORT, this is what it looks like. It's actually, because CONSORT was mostly aimed at trying to get better reporting of methods and results, most of the guideline is about the methods and results section and precisely what you should put in there. There is some detail on the introduction and discussion, but that's less complete. So I'll give you a bit more detail about what you might put in a structured discussion section, because that's not the main purpose of CONSORT. But in terms of the methods and results, all the reporting guidelines are very good at the MR part of IMRAD, a little weaker on the I and the D sections for that. That's probably not true of PRISMA, Matt, but most of them that's true of. So you'll see for a trial, for example, you want the basic design, the participants and how you recruited them, descriptions of the intervention, your primary and secondary outcomes, how you got the sample size, how you generated the randomization sequence, blinding and statistical methods, etc. And often people will put in the headings for that. You don't have to, but it's actually quite helpful, I think, to the readers if you put in at least some of those headings as well. So the 2010 version had 25 items. And one of the great innovations of the 2010 guideline was to have this so-called CONSORT flowchart, which has now been adopted. So in PRISMA, there's an equivalent for looking at how you screened and extracted the papers, etc. And there are equivalents in things like STAR-D and STROBE to have this flowchart, which is very helpful because a lot of the elements of it were often omitted in papers. Unfortunately, it's not always there. One of my favourite titles of a paper ever is "Where Have All the Rodents Gone?", which was about the effects of attrition in experimental research on cancer and stroke. This was about rats and about whether they gave the sample size and whether there was a discrepancy between what was in the they said they were going to get and what was in the results section. And there was a lot of unexplained missing data within that, whether it was either unclear or unexplained attrition. And only about a quarter of them actually could you match everything up perfectly. So one of the reasons I put that up is the problems that CONSORT, etc., are trying to solve is for human clinical trials, but it's true of a lot of research, including animal research, and in fact, including when you go outside medicine to ecological research, etc. And damn it, jumped. So I'm going to jump into how you can use the reporting guideline to help you write a paper but I just again wanted to do a Slido and thought, what is it that you find hard about writing research papers? If you can write a phrase or a word. Getting started. The implications section, yeah. Okay, defining contribution, time commitment, discussion, yep. I actually now like writing discussions, but the structure helps it. Meaningful discussion, yeah. Dealing with co-authors, yeah. That's not a process I'm going to go through in any detail, but it is definitely a problem, is getting co-authors on side to contribute appropriately. Mm. No, it's interesting. So I'm actually going to go through a little bit about the discussion section, but also a little bit about the writing process. So that's very interesting that a lot of people find the getting started part very difficult, and a particular thing is the implications and discussion and making it easy to read and understand. Yep. Okay, so 3/4 of you have actually used a reporting guideline. That's great. Most people that I know of use it as a sort of checklist a bit after the fact. And I want to really talk about how you might use it as scaffolding. In a way, if you've done a Cochrane review, Cochrane forces you to do that by the structures that are within a Cochrane review through the subheadings there. But a lot of things don't have that. And so it's useful to set up your scaffolding specifically using the reporting guideline. And so my suggestion is that you should find the reporting guideline that's relevant. This is a way of getting started. Put it into the IMRAD format and put in all of the subheadings. So if you take the reporting guideline in a Word template and then put in all the pieces that you're supposed to put in order in the introduction, methods, results, and discussion section, and then start filling them out. So all of the reporting guidelines you can think of as just, they're like Day's writing guide, except in more detail and more specific for different study types. And they're just giving you advice about what goes where, which makes it easier to get started as well, because you now know what you need to put in what section. That work's already been done for you by the reporting guideline. So if we look at, for example, COREC, these are the elements of it. Most of them relate to the methods section or the protocol of that. And so when you're writing your protocol, so that not only writing the paper, but when you start by writing the protocol, that's actually the IM section of writing a paper. And it's a very similar thing for this STROBE checklist here. Again, a limitation on doesn't have much in the introduction and discussion. It's a little more complete than the CONSORT, but it's really focused on the methods and results section. So that's for observational studies. And as I note down here, the IM is the protocol. So one of the things I always suggest to people is that when you're writing your protocol, the introduction and methods effectively, you should think, I'm not writing the protocol, I'm writing the introduction and methods section of my future paper. Okay, you may have to put in a bit more detail than you're going to end up with in the paper so it can shorten it. But basically, don't think that you're doing two jobs. You write the protocol, use it to guide the research, and then you throw it away, and then you start writing the paper. No, think about the paper, the IM part of it as what you're doing when you're writing the protocol, which is a time-saving device. And the one unfortunate thing is you have to at least change tense. So in the protocol, you say, we will, and then you go, we did. when you get to writing the paper up. And in fact, a colleague of mine in Oxford wrote a thing that automatically flipped the tense for you once you'd finished your protocol. It could write the results for you by flipping those. So that's my key sort of comment in terms of the scaffolding. And as I said, the one piece that I think is not complete in most of the reporting guidelines is the discussion section, where you want to put up the main findings, discussions of weaknesses and strengths, relationship to other studies, particularly any differences in the results, the meaning of the study compared with others and possible mechanisms for that, the implications for clinicians and policymakers, and finally, any unanswered questions and future research. And then you can go to even more detailed levels than that. If you look at the Cochrane handbook, it'll give you an even more detailed process for doing reviews and that. And one of the things I suggest is you can, as I mentioned earlier, you can use those all as temporary headings. So I would create a Word document with all of these things as temporary headings, which I might either shorten or delete once I get to the final version of the paper. But for a long time, you want to leave it there because it's all the scaffolding that you need. And when you've finished, you can take a lot of that scaffolding down. Okay, IMRAD. What order do you write IMRAD in? Introduction, methods, results, discussion. Where do you start? People said they had trouble getting started. Where do you start? Okay. Almost everyone says methods. One person said the introduction. You probably want to define the problem, but that's not the whole of the introduction. That's the thing that your sort of research question, you want to do that at the beginning. But that doesn't necessarily mean you write the whole of the introduction. And someone wisely said, I check for a systematic review. Yeah, that's a good idea. And you could also look for the methods of good papers. So one thing a systematic review can help you with is if there are several similar previous studies, you can look at its risk of bias and use that to pick up on what are the best methods that have been used to address this or a similar question in the past. It's not plagiarism, it's building on the best. You don't have to invent everything from scratch in research. Okay, so a great idea to start with the methods. In fact, you don't have to write everything in there. So some people mentioned dealing with their colleagues is a difficult thing. One of the things that having this detailed structure allows you to do is to allocate out particular sections. And you can do that even within a section. We would typically, in writing up a study, say, you're in charge of the introduction, somebody else is in charge of the methods, somebody else is in charge of the first draft of the results, and somebody is in charge of the discussion. And you all hate discussions, so I usually land up with that job and I've learnt to enjoy it. Just because nobody else wants to do it. But now actually quite using the structure, I've actually found it much easier to do. But you sometimes want to do that in more detail. If you're writing the methods, you may allocate out the intervention section to somebody. The statistician may write up the sample size and statistical methods component. So you can break it down in even more detail than just the IMRAD by having that structure, and everybody then gets an allocation of how you write. So I found this very interesting thing from Elsevier on how you should write a paper. They say prepare the figures and tables, then write up the methods and then write up the results. Well, I almost agree with that, except as everybody said, you should write up the methods first because that's your protocol. You should have already have that written. But I do agree with their other thing of writing up the figures and tables. Again, in your prior to doing the study, you may have actually dummied up some of the figures and tables, which is a great idea. But you actually then want to have all the figures and tables ready before you can start writing up the results. And then write up the discussion and then maybe the final conclusion. write a compelling introduction. We'll often do that in parallel because while somebody is doing all of the other sections, somebody can be polishing up the draft introduction that was done in the protocol. I probably would get the snappy title right at the end, but the abstract I'd probably want to have written earlier as well. And you certainly want to think about the acknowledgements and keep a record of those as you go. Okay, so my main tips for efficient writing: use a reporting checklist as a template early on in the process, preferably right at the protocol stage, and then you can later on modify or delete the unnecessary headings that you don't want. Protocol is the IM of your IMRAD, so reuse that when you're writing the final paper, and then write and revise the IMRAD in the order that suits you and allocate the team members. It's easier with the agreed template. And I should mention finally is we've been working on some ways of making this even easier. So that's as easy as you can get it manually, but we've been starting to automate it. So in our systematic review accelerator tools, which are free and you can get at this website here, we have a thing for systematic reviews called the Methods Wizard, which asks you a series of questions. And I'm not going to give a full demonstration of this. You can go and look at it. It asks you a series of questions about the PICOs, the population intervention comparator, some questions about what databases you're going to search, et cetera, and then it writes the sentences for you. So it's like somebody quizzing you about all of the bits and pieces that you need, but it's got some canned sentence structures, usually several for each of the sections, and you can generate different versions of it. It randomizes those, and then it writes the sections for you. And we now sit down with this to make it much easier to write the protocol section. It would typically take us 1 to 2 hours to do that, but we do it as a team so everybody's on the same page, and it's focused on the issues, not the writing, because of the way this works. So that's working pretty well, and it's free to use. As I say, we have a beta version and one for trials, and we're working up one for scoping reviews and one for clinical audits at the moment, but they're currently not available, but should be available within the next few months. Okay, and a reminder about the websites. The Equator website is one, and for checking manuscripts completeness, you might want to use Penelope as well. And I'm going to hand back now. I think, Matt, you're up next. But if there are any questions or comments from any of that, can you please post them in the chat?
All right. Thanks, Paul. Okay, you can see my slides.
Yes.
Yep, great, cool. All right, so I'm going to talk about using one reporting guideline in particular, the PRISMA 2020 statement, to help improve reporting of systematic reviews. Just to give you an example of what this reporting guideline looks like for those who haven't actually taken a look at it yet. And I'll include an example at the end showing you some, I guess, examples of how someone has used PRISMA to inform their reporting, and compare that with some reviews that are not as well reported. I mean, I think as Paul's already introduced this topic, we want to have complete reporting of not just systematic reviews of any type of research, but in the case of systematic reviews, we want to have a complete report so that users are able to know why we did our review, what particular methods we used, for example, what sort of databases did we search, what outcomes were we interested in extracting from the included studies, and then what did we find? What was the results of our meta-analyses, for example? And having a complete report of all that information is valuable because it means that our end users, such as our other researchers, patients and clinicians who want to make evidence-informed decisions making, they're able to actually rely on a detailed report of our research to make the right decisions. And a complete report of a review also enables others who are interested to actually repeat our methods to see if they actually obtain the same results. And finally, it allows people to assess whether they can actually trust the findings of our review, because they can see if the methods that we have used are at a high standard and unlikely to have resulted in bias in the findings. And so a popular reporting guideline available for systematic reviews, primarily in the health sciences, is the PRISMA statement, with PRISMA standing for Preferred Reporting Items for Systematic Reviews and Meta-Analyses. And so PRISMA was initially published in 2009, and then myself and colleagues updated this to the PRISMA 2020 statement a few years ago. And this is essentially a checklist or guideline providing authors with guidance on what to include in a systematic review manuscript. And so PRISMA, the checklist itself is divided into 7 sections covering essentially that IMRAD sections that Paul has already introduced you to. As Paul also pointed out, that PRISMA, like many other reporting guidelines, is quite methods and results heavy in terms of the items that it presents, with only a few on the introduction or discussion section. But it does provide a lot more detail on what to include in both those methods and results sections. And so this is just a screenshot of the checklist itself. As you can see here, most of the checklist for the first of the 2 pages is devoted to providing guidance on what to include in the methods section, with then the next page, about half of that devoted to the results section. And then we have a few items on the discussion and some other information that we'd like to see in a systematic review report relating to, I guess, open science practices such as registration and sharing of data. In addition, we have, to these checklists, we have a template flow diagram that authors can use to illustrate the flow of studies from their searches all the way to the inclusion in the review. And one thing I have discovered in recent period is that I often come across people who say to me that their understanding is that PRISMA is just a flow diagram. They're actually not really aware that it does consist of these checklists of items recommended for reporting across the whole systematic review. So I think we need to do maybe a better job of correcting that misinterpretation of what reporting guidelines are. It's not just the flow diagram. So information about the PRISMA 2020 guideline is available in these 2 papers that were published in the BMJ. There is this statement paper, which is quite short, just presents the checklist and the template flow diagram and gives a bit of information as to how the guideline was developed. And then there's this much longer explanation and elaboration document, which is often accompanies most other reporting guidelines, or at least the major reporting guidelines on the Equator Network website. And the structure of this explanation and elaboration document is as presented on this screen here, whereby for each of the 27 items in PRISMA, we have provided an explanation as to why we think authors should report this information in their report. So give some evidence, ideally evidence-based justification for why it's important to document this information. And then we have what we call elements or reporting recommendations, a bulleted list of recommendations that essentially elaborate upon the checklist item itself and gives more detailed guidance on what sort of information we'd like to see reported in systematic reviews. And then it's followed by an exemplar from a published review. So a really good example of good reporting for each item is provided in this explanation and elaboration document. So it's well worth consulting these documents. I think they tend to get far fewer citations and accesses than the main statement paper, but they do provide a lot of valuable information to help guide your reporting. And then also there is a checklist for what to include in a systematic review abstract as well, for both journal articles and conference abstracts. Now, accessing the PRISMA checklists, where you can actually access them is at the PRISMA statement website, so www.prisma-statement.org. And this provides free access to all of the documents. There's a tab here called translations. So at the moment we have about, I think, 14 translations of the PRISMA 2020 statement that have been done by volunteers over the years. And then we have these extensions tab as well, which essentially gives you a list of all of the other extensions to the PRISMA statement that have been developed over the years to address specific aspects of systematic reviews or particular parts of a particular article. And so there's quite a lot of checklists and guidance available on the website. You can access it in the PRISMA 2020 checklist tab. You can download as either a PDF or a Word document the 27-item checklist to help guide your reporting. But we've also developed a Shiny app as well for those of you who are allergic to using Word documents. You can actually go to this website here and essentially complete the checklist online, and then click on this Generate Report button, which will then download either a Word document or PDF, which then you could submit and upload with your manuscript when you're submitting your paper for publication. We also have Word templates for the flow diagram as well, and we've created different templates depending on what type of review you've conducted. So whether you're doing a completely new systematic review from scratch versus updating an existing review, for which we have a different template to record the flow of studies throughout the process. But similarly, because we know that not everyone wants to use these Word documents, we've also developed a Shiny app, which enables you to record the relevant numbers, which then populate into this particular image file that you can then download and then include as a figure in your manuscript. So different ways in which you can access the checklist and flow diagrams for PRISMA. Now, again, how to use a PRISMA 2020, similar to what Paul said, essentially how to use any reporting guideline is that really encourage people to refer to these documents much earlier in the writing process. I think that the standard process that people use is that they first become familiar with a reporting guideline like PRISMA at that time when they're submitting an article for publication, and editorial manager prompts them to upload a reporting guideline checklist. At that stage, I would say that most authors will have gone through multiple revisions of the article with their co-authors and are really less willing to make any changes to the manuscript at that stage, when really they just want to submit it and get it through into the peer review process. So as Paul said, creating templates which indicate, essentially map the reporting checklist items into, say, a Word document is a potentially useful activity. And that's something that my colleagues and I at Monash University in Melbourne are starting to look at developing templates for PRISMA 2020 and roll them out and see if they have an impact on improving authors' reporting. But then again, once you've written your manuscript, at that final stage, I think a lot of journals are still asking people to upload completed checklists. And so it is helpful to indicate in these downloadable checklists we've developed which items you have reported in your manuscript and whereabouts they've been located. So what page number, whether they're in a particular appendix or in say, an open science framework repository. And something we often keep on repeating when it comes to reporting guidelines like PRISMA is that while they tend to follow a structure of this is the items in the method section, this is the items in the results section, for example, they're really just a guide, a prompt for you to document that information at least somewhere in the manuscript, because we know that journals have some journals enforce word limits, and so it can be quite difficult to essentially adhere to every item in a reporting checklist within the whatever 3,000 word limit that you might have. And we're not sort of saying that you must adhere to all those sections when you're writing your reports. If you have a lot more detailed information that you can include in an appendix or include in a repository, then please do so. Make that information available and indicate in your checklist that it has been made available in that section, so that it's at least available somewhere. Now I just want to give an example of some good and bad or not so good examples of reporting. These were collated by Tammy from Bonn University. So thanks for finding these helpful reviews for us. So this is a particular review. If you are working on a systematic review or are interested in finding a good systematic review to help guide how to report your own review. This is a good example here by Giovanni Ferreira, looking at the efficacy and safety of antidepressants for the treatment of back pain and osteoarthritis. And so this was published a few years ago in the BMJ. And so just giving an example for the abstract alone. So we have about 12 checklist items recommended for reporting in the abstract. And I think this is a good example of showing that even in a small abstract, it can be done. You can actually adhere to, in this case, almost all of the reporting items. One thing that was missing from this particular abstract is information for item 11 on the primary source of funding for the review. But essentially, there is at least some information addressing all of the other items, including the objectives and the data sources that were consulted and the eligibility criteria and analysis methods and results. So it can be done. You can manage to squeeze this information in an abstract. Another section of the review looking at the eligibility criteria. This was another good example of good reporting for one of the items on asking authors to specify the inclusion and exclusion criteria for the review, where the authors have essentially pointed out what sort of study designs they were including, in this case randomized trials, what sort of patients were eligible for inclusion. So these were studies of people with back pain, defined as neck or low back pain with or without ridiculous symptoms, and hip or knee osteoarthritis. They've defined the types of interventions and eligible comparators, being either active or inert. And they've even gone to provide even more detail than many people provide, which is specifying what types of reports were eligible for inclusion, in this case, peer-reviewed reports as well as unpublished data. And then they've clearly indicated what types of studies were ineligible in this review. In terms of the search methods, this was also done relatively well, with the authors indicating what databases and registers, such as clinicaltrials.gov, were actually accessed. And they provide the specific date on which the searches were run, which I think is something that's quite rare. I often see a lot of people tend to just say that searches were done to, say, May 2020, whereas it is helpful to give an exact date, month, year date, in order for people to know exactly when is the time to update the search, and what sort of records are actually included by that specific date. And then included in a supplementary file the search strategies that were exactly as run in each of the databases. That sort of information is typically not seen in the main report, but can appear in your appendix. In terms of the methods they used to select studies, they also made it clear the number of authors that were involved in this process, and that 2 of these people did this independently, screening titles and abstracts and the full text reports. And then they had, they basically discussed any possible disagreements at that step of the process. When it came to defining the outcomes, again, this was relatively well done in terms of identifying what were both the primary and secondary outcomes for the review. And something that's rarely seen, but that was introduced in PRISMA 2020 is a recommendation to specify which types of results were actually extracted from the included papers, because sometimes that's a bit of a black box. And what we often find is that in the papers that we include in a systematic review tend to have multiple results that could actually be compatible with the outcomes that we're interested in. And so these authors have they've defined some time frames that they were interested in conducting their analyses. And then they indicate that if there were multiple results at multiple time points available in the included studies, then they would pick the one that was closest to these particular weeks here, just so that it's clear to authors what they did when they're confronted with this multiplicity. In this case, when it came to the risk of bias methods, this was not necessarily done as well, in that the authors did tell us how many reviewers did a risk of bias assessment, but they didn't give much details about the particular tool used, other than just saying it was the Cochrane tool. They didn't indicate if this process was done independently, and so a bit more information there would have been beneficial. But in contrast, a different section or different method, that of assessing certainty or confidence in the body of evidence, which is typically done using the grade framework, was done reported in quite a lot of detail, including in a supplementary file showing the particular grade framework used. And then finally, in terms of methods, the methods for data analysis were also quite clear in terms of which effect measures, which models we used, and which statistical software packages we used to run the analyses. Getting to the results, the authors did a good job of presenting a PRISMA flow diagram showing the flow of studies throughout from those that were initially identified in the search to all the way down to included in the review. They did provide in the supplementary file a very detailed table which presented the characteristics of each included study and provided a reference for each included study. In addition, they provided detailed assessments of the risk of bias for each study included in the review and summarized that nicely in the paper. And then when it came to presenting the results, for the most part, this was quite good and adhered quite well to PRISMA, in the sense that the authors presented the overall pooled result, or the summary effect estimate, and its precision for each meta-analysis, gave some results of heterogeneity statistics, also provided information on the effect estimates for each study, and an indication of which group was favored, using these labels on the forest plot and then within text as well. One thing that was missing and would have been beneficial is to provide the summary statistics for each group, such as the means and standard deviations for the SNRI group and the placebo group. But that's kind of the only thing that was lacking in that regard. And then finally, there was in the back section of the article, they gave useful information about the funding sources and competing interests of the review, authors, and included a data sharing statement. Now, this review contrasts to a different review which was published a couple of years ago, where looking at the abstract for this review, there's quite a lot of the recommended items are missing, such as the date when the search was conducted, the methods used to assess risk of bias and to synthesize results. There wasn't really any summary of the limitations of the evidence, and some of these other information was also lacking from this abstract. And then looking at the main text as well, this was surprising to see in a very recent systematic review, which when it got to the results section, it just says 4 papers met the inclusion criteria. There's no flow diagram, there's no indication of how many records needed to be screened even. So that's quite unusual for a recent systematic review. And not necessarily, well, definitely not a good example, not something that would adhere to PRISMA. So just to summarize, PRISMA 2020 It does include reporting guidance for all sections of a systematic review manuscript, and we have created both Word templates and Shiny apps to help authors complete these checklists and flow diagrams. Because there can be updates to PRISMA over the years, it's worthwhile that every time you need to use a reporting guideline, and it's not just PRISMA, I would say it is about every reporting guideline, it's well worth going to the Equator Network website or to that reporting guidelines website to download the latest version of that checklist and flow diagram template, because it might have been updated in between the time since you've last accessed it. And there's my email in case you need to contact for any further details. But I'll stop there and I'll stop sharing. And I think, or we move straight on to Ginny.
Yeah. But if people could type, if you had any comments or questions about what Matt has said, please put them in the chat now and we'll come back to those at the end, but we may move straight on to Ginny.
All right. Hello, everybody. Let me just get this up. So I'm going to give you a sort of quick tour through reviewing and being reviewed, and a sort of a little bit of a sense of where we also put where reporting guidelines fit into this. So I do want to also do a bit of a Slido. So I'm going to put the link in the chat. It's a different one from Paul. So if you don't mind going to that, that would be great. And what I want to do is to get a bit of a sense of your experience in doing peer review. So the first one should be coming up, and I'm just going to stop sharing this for a moment and share my share something else. So give me a moment. So the first one is about how experienced are you in peer review? So can you see that and have a go at answering it?
Ginny, you stopped the slide.
Yeah, I'm going to them. I'm going to.
I see.
Go to my desktop to show the to show this. Excellent. All right. Okay. So if you can type in how regularly what's your experience of peer reviewing? Is everybody seeing that? Okay, or not? No, not yet. Hold on a sec. There we go. Are you seeing it now? Okay, great. All right. So I won't take too long on this. So people peer review regularly. Some have been the author of the peer review, been a reviewer once or twice. I'm glad to see nobody's written the book on peer review. That's kind of great. You can say it if you have. All right. Let's go to the next one. So what's your experience generally of being peer reviewed? And I'm not going to take this personally as a journal editor or as a peer reviewer. I'm genuinely curious to know what people's experience has been. Again, I hope everybody's seeing this on the screen. Are you seeing the results on the screen okay? Well, it's blank at the moment. I've run sessions like this quite a few times. Oh, thank you. Well, there you go. That's a very honest response, the one that says distressing. I do appreciate that does happen to people, not infrequently, and that's not something that I kind of would like for people to have as a experience. I'll give it a couple more moments. Viewers, comments, polls apart, I completely agree. And I will say this is one of the experiences that I've absolutely had as a journal editor. It's extremely common when you get peer review comments back. You'll get one reviewer that says minor revision, another reviewer says major revision, another reviewer will say reject. It's incredibly common. So the job of editors actually is to sort of navigate amongst all of that. Sometimes constructive. A couple more folk typing. All right. I think everybody, I think what I'm seeing there is that people are experiencing the range of peer review that is quite common. But you know, it is certainly true that it can be a stressful thing, if hopefully if not distressing for most people. Help me change my approach. Okay. All right, I'm just going to go on to the next one, which is, have you had any training on peer review? So for those of you who have done it, which is quite a few of you, would love to hear what you've had. So whether you've had any, whether you haven't had any, but you'd like to have some, perhaps you got trained on the job by a senior colleague, came to a session like this. I'm hoping that none of you do the training in peer review, but if you are, let's chat afterwards. And I'd love to know if there's any formal training that people have had. Okay. All right, couple more seconds. So the vast majority, no training on peer review. Most would be keen to have it for a third of the group. And some people, the next thing that is people have had a session like this or had some advice from a senior colleague. All right, great. Thank you. That's really helpful. I'm going to stop showing that and go back to my slides. So I get a sense from what we've got here is that people have done a bit of peer review, that they have but not been formally trained in it, and that it's not always not always a terribly constructive thing, which I'm sorry to say is the case for lots of people that I speak with. So I'm going to do a whiz through reviewing and being peer reviewed, and then I might just quickly talk about the approach that we've tried to take at the MJA. So my substantive job now is I'm the editor-in-chief at the Medical Journal of Australia. I have reviewed and worked at a number of other different journals, and so what I'm going to talk about is a sort of amalgam of things that I've gathered over the various jobs that I've been in. So the way I think about it is like this. I think peer review is a dialogue. So I know that often, particularly more junior researchers, think that peer review is something that's quite distressing, that it's intended to, I guess, to sort of be very negative. But actually, my view is that peer review is an important way of having a conversation between the people that are aiming to publish the paper, the editors and peer reviewers, and the authors. And what is really critical in this, I think, is to consider the other perspective. You know, it's a rare peer reviewer that's never been an author. And, you know, most authors at some point in their life will probably get asked to do a peer review. So I also think it's quite a social activity. So I divide it into two types of peer review. I think there's the informal thing that happens, you know, when you talk about it amongst your colleagues when you're writing the paper, or with colleagues who are sort of involved in the same area of research, but not necessarily on that paper. And then there's the more formal peer review, which we often talk about, which is at the journals, and that involves journal staff, the editors, and the peer reviewers. And I think the informal peer review is a really important part of the whole process. I mean, it's rare in the areas that I think all of us would probably work into to write in isolation. I mean, that's not true, for example, in the humanities, where sort of single authored papers are more common. But in the area that I work in, you know, single authored papers are pretty unusual. And it's unusual now for individuals to be working not as part of a team. So I think it's a really important part of the process before it gets to the journal. So it basically, the job of it is to get the best paper that you can to your journal, or if it's to a conference, if you're submitting there. And all these things are important. And one of them, the key one, is about the appropriate reporting. And as Matt said, you know, this is the stage to be thinking about when you're thinking about your reporting guideline, not at the point when the journal asks you for it. I think the aim of formal peer review is slightly different, but it's still on that continuum of being a sort of social activity. Essentially, from a journal's perspective, we want to publish a work that accurately reflects the work that was done. We want everything to be in there that needs to be in there and no missing parts. So again, that's where checklists are really critical. Or if we're not going to publish it, then it's to try and give the authors constructive feedback on why the paper doesn't fulfill the journal's criteria. Now, that's not always possible. And, you know, I'm sure that many of you will have been recipients of sort of straight out rejects from journals that just basically turn around and say that they're not able to publish a paper and they don't take it to peer review. For example, at the MJA, we get 1,400 submissions a year and we only publish around 250 or so of those. So most of the papers that come to us won't get an in-depth peer review, but the aim of when you do get the peer review is it should be constructive. So I think really in both formal and informal peer review, reporting guidelines are really of help. Now, guidelines they're not the whole narrative of a paper. And again, as Matt alluded to, when you write a paper, where you report something can come in multiple places within a journal, within an article. But the checklist is there. It's exactly as a checklist. It's there to help you make sure you don't forget the essential points that they're included in the paper. So thinking about peer review, I mean, the first thing I just want to sort of emphasize is that you probably all of you get requests for peer review. Certainly if you've been an extensive author in any, sort of in more than one journal, you'll be getting peer review requests. One of the things I hear about quite often is that people getting peer review requests from journals they've never come across. And there's a really nice site called Think, Check, Submit, which is primarily designed at authors thinking about where they might submit a paper to. But it's actually got a really useful checklist about how to think about what a journal you might peer review for. So my general feeling, and I think, this is a case, coming back to this social activity, you want to generally review for the journals where you're likely to publish or where your colleagues would publish. And if you think it's one that's worth your time. So do think critically about journals that you get involved in. If you do think it's a journal that's reputable and you want to review for it, well, think about, are you qualified to do the review? Do you know about the model of peer review? So is it, for example, is it single anonymous or double anonymous? So are you required to sign your review? Is that a problem for you? Think about your competing interests if that's obvious to you. Sometimes in journals where they don't tell you who the authors are, that can be tricky, but you can sort of guess it. And really importantly, can you do it in the time frame? It's absolutely fine to say no. Please don't hang on to papers if you don't think that you can do them. I'll tell you a story about a very senior person that once said to me that their approach to peer review was that when they got a peer review, the first thing they did was they panicked. The second thing they did was sit on the paper for a month. And then the third thing they did was send back a one-line review. Well, none of that is helpful. So I'm saying, so now this is how to think about peer review. Don't be that reviewer that kind of doesn't know even where to start. So if you get the review, read the review request carefully. Often it's the case that journals will ask you to look at one specific part of a paper. So they might not ask you to review all of it. So particularly if you're a methodologist, they might ask you to review the methodology. If you're a content expert, they may ask you to just look at the content as opposed to the statistics, for example, and have a look about the structure of how you're asked to do the review. So before the paper comes to you, if you have agreed to it, there's a few things that you should have already been decided. Again, it should be worth your time. And with regard to this particular session, if there are reporting guidelines, if they are requested by the journal, they should be available to you and the journal should have requested them. And if they haven't and you think they're valuable, it's absolutely worth going back to the journal asking for those. So this is my approach. I mean, I know there's lots of different ways to review papers, but this is what I do. I read the paper once straight through. I was interested when Paul asked the question about where do you start with writing a paper. I often ask people where they start with reading a paper, and I start with the methods actually, because I think that's the most important part of a paper to understand whether it's rigorous or not. I then look at the results, and then I'm essentially looking for validity. And this is the point at where the checklists come in as incredibly valuable. The introduction and the discussion to where does this fit in relation to other work, that's more of the narrative around the research. When you write the review, again, there is lots of different approaches to this. The one tip I think that has actually saved people a lot of anxiety at various times is don't write it in the review system. All of these systems have a horrible predisposition to crash halfway through you writing it. So write it outside the review system, write it in a Google or Word doc, wherever you think it's useful to put it. I really like it when this is what we put in our guidelines for authors and reviewers at the MJA, was we ask for a summary of the paper. We suggest they do that. Put your major points in. If appropriate, has the reporting guideline been followed? We ask that of our methodological reviewers specifically. Then number any minor points. You may be asked to give separate recommendations to the editors, in which case I much prefer that you don't make a different set of suggestions compared to what the authors see. And you may be asked to make a recommendation about publication. So here's a quick one. Just this is a completely made up paper. really short review, one that I quite like. There's a sort of structure. So you've got the summary at the beginning. You'll notice the tone is quite constructive. One of the major points that this author picked up was the data sources were not well described. Although, interestingly, the author had said, well, they're present in the STROBE checklist. And this is really quite common, that authors will tick something and not actually have done it. So if you've got, as a reviewer, it's useful to be able to map those two back against each other. So here's some do's and don'ts. Really important to be polite and constructive. Make sure that you're accurate. You don't have to know everything, but if you don't know it, that's fine. But don't please guess things. And then follow the author's instructions. I have a really, I'm really keen on this at the MJA. We say that we have no time for rude, sarcastic or unconstructive reviews. We may well edit reviews if they do include this. We do say to authors, please don't reviewers, sorry, don't rewrite the paper. You're not, it's the author's research. You're there to assess what's presented to you. You may suggest extra experiments, but you're not trying to redo their research project. And then obviously, if you find things that are really problematic, my suggestion is to go straight back to the editor themselves, say that you've seen something that you're worried about and you don't want to continue with the peer review, and ask them for their advice on the next steps. Okay, so what about responding to the dreaded peer reviews that have come your way? So again, just constructiveness is really keen. But you all know this, that peer reviewers largely are not paid for what they do. They're doing it in their own time. They're taking their time to read your paper and provide constructive feedback. So in the hope that they provided constructive feedback to you, then be polite and constructive back to them. I think there's an opportunity it should be an opportunity to improve your paper, and I saw that in some of the responses. I always say make the editors and the reviewers life really easily to see how they've responded. We actually had a conversation just about this at the MJA yesterday. And again, this is another example of come back to where the reporting guideline can help you. Look at it critically, look at what the reviewers have pointed out, or the editors, because you may get separate comments from the editors, and see whether you've got everything in there that needs to be there. I think a really key thing that probably very experienced authors would agree with is that don't respond immediately. Read it, take the time to think about it, and definitely don't be unprofessional. I think it's really important to take a systematic approach to responding. So I'm talking here particularly to you if you're the corresponding author. Make sure your co-authors know the viewer is back. So most journals nowadays will send letters to all reviewers, all authors of a paper, but that's not always the case. If you're the corresponding author, it is your job to make sure that your authors know about it and that they know which parts of it they have to respond to. Take a really a systematic approach to collaborating on the review. And Paul indicated earlier that there may well be multiple people that have written the paper or different sections of the paper, so you might want to farm out the response to the reviews, and that's okay. But make sure that in the process of doing that, you've gone through and looked at everything that has come from the editor and from the reviews. I really like the idea of tables. We don't do this systematically. In fact, we've just had a conversation about whether we should ask authors to do this on a sort of more systematic basis. I find this immensely helpful if authors do this, is they take the review comment and then they respond to it systematically. So here, for example, in red, you see that the reviewer has said, well, the source is well described, but they're not marked as present in the STROBE checklist. So the response from the authors is, thank you, we've updated the paper and we've looked at the checklist again. So that's a really helpful response. If you can give page numbers, that's fine. But we know that one of the things that absolutely happens with checklists and where you've where you've put something in relation to the paper itself is that page numbers may change, and that's one of the challenges that we often have with checklists. But noting that it's there somewhere is kind of useful in itself. So I've talked about the system for collaborating. When you're ready to submit it, I find it massively helpful to have a cover letter that again addresses issues that are not in the specific responses, but make sure you've got that table. Don't forget to submit a track change version as well as the clean version, and keep a record for yourself of everything you submit. And then I'll just finish by saying that there are lots of new models coming out there that you might well be come across. So many of you may well have submitted preprints, and associated with preprints are sort of overlay journals where the peer review happens on a preprint that's already been published. That's a model that eLife, for example, is doing at the moment. And there are journals that publish revisions, so that you can publish the first version plus the reviews, then the authors can respond, publish a second version, and so on. F1000 Research has been the journal that kind of pioneered that, and that's now in a few journals that you might see around the place. For example, Wellcome Open Research and Gates Open Research have a similar model. So there's lots of different models out there, but as I said, regard it as a dialogue and regard it as a kind of opportunity to improve your paper. And I would just say, if you've ever had a review from the MJ that you don't think's great, I'm really keen to hear it. I'm not keen to tolerate any sort of poor behaviour in the review process. So I've put a couple of resources up there. I will also just say, if you're interested at PLOS, we also have resources for reviewers at the moment as well. So I will stop there.
Excellent. Some really interesting ideas there, and good advice, Ginny, as well. I was wondering if there were any questions from anyone. You can either type them into the chat, but since we're a fairly small group with just 20 folk, if you want to unmute and ask a question, that's fine as well. Or make a comment. Give Ginny your opinion about the MJA and the terrible reviews you've received.
Paul,
Ginny,
oh, you go. Sorry.
In your table, the one thing missing from that I usually add in when I do the response to reviewers is I let the editors know whether I have I separate out the change that I have made, or whether there's a change at all from the justification for that. So there's, in a sense, two responses always. One is, here's my reasoning and here's what we've actually done. And sometimes that's no change made.
Yeah, and that's fine too. And often people, conflate the two and just say, make that as a thing. One of the things that we say to authors is that you don't have to change your paper every time, but we do ask you to respond to the reviews. And one of the very frustrating things that, again, we know happens all the time with reviews is that you may get divergent review opinions amongst the reviewers on your paper, in which case that's the job of the editor to say, well, we'd like you to respond to this comment from reviewer 1, noting that reviewer 3 had a different opinion, and that sometimes happens. And that's kind of okay.
Yeah. It reminds me of something else I do, which is when the reviewer asks me to do something that's probably outside the guidelines, like they want 6 new figures, I go, well, I say I'll leave that up to the editor. We're willing to do the 6 figures if the editor will accept them.
That's right. Yeah. Papers can end up as sort of, these enormous sort of 20-page things that, when they started off as something small. So you're right. That's a useful approach. Yeah. And I've just put in the chat the instructions for authors and reviewers, and really happy to actually get any feedback on them. I hope that people find them useful. We send them to our peer reviewers when they agree to review for us, just as an indicator of what we're looking for.
Any other comments, issues that people wanted to raise that we didn't discuss? Xavier asked, do we have reporting guidelines for qualitative studies? Yes, if you look at the Equator website, there's actually several different ones for qualitative studies. I'd have to get those up to see what they are. I don't know if someone else can find it quickly than I can.
We usually point people to I think it's the COREC ones.
Yeah, COREC is what I showed, but I think that's the most common.
Yeah, that's the most widely used one.
Okay. Qualitative SRQR is the other one that's listed on the Equator website.
Can I mention another reporting guideline? I'm just going to put in the chat here, which is the consider statement. Now, I don't actually know whether this is on the Equator site, but this is about if you're doing research involving Indigenous peoples. This is one that we've just started using at the MJA, and it's worth looking at, I think, if you do research in this area.
Thanks. Yeah, one thing we haven't discussed is where sometimes you may need several reporting guidelines. And Tammy, you may like to comment on that because you may have a consort one, but you need a tidier extension as well for your complex intervention.
Yeah, that's right. And so journal instructions haven't evolved to recognize that. So it's, the responsibility lies with the authors for realizing that. I mean, it's the same with any of the extension ones. So harms, for example, the consort harms extension. And while in the new consort and spirit that are coming out soon, some of the key items from those extensions have been integrated. A lot of the times they do say, and for the full details, please use, tidier or the harms extension. So it's worth being familiar with all the main extensions that exist for the main reporting guidelines, because you may well often need to use more than the main one, and just upload two reporting checklists. And sometimes the extra information can be provided in a table or a box, and that takes care of it.
Yeah, and in the systematic review world, in the PRISMA world, we're currently working on harmonizing the different extensions and creating web apps that essentially, once you define which extensions would be relevant for your review, it would come up with a customized checklist that takes items from the main PRISMA statement and the ones, any unique items from the extensions, so that you are able to tick them all off and not have to sift through these multiple overlapping guidelines. So that's something that's coming in the future.
Okay. Any other?
There's a question in there about involving consumers in research and whether there's any tools to validate some of their contributions.
I'm not aware of any that specifically address that. I think just under the sort of like in consort one, the new one, that it'll just, if they were in which parts they were involved in, you just describe their role in which parts of the methods. But I'm not aware of any standalone checklists that cover that.
I think the key thing really is I think we've all kind of emphasized this, is that the guidelines they're guidelines, they're not meant to be immensely rigid. They're there to help you improve, the quality of your reporting. And it's not uncommon for us to say to authors, to actually genuinely not be able to say which is the right guidelines. Sometimes it does cross a multitude of them, and, do the best that they can to make sure that they've reported what they think is needed for the paper to be reproducible, which is the key thing really, isn't it?
And just to expand on that, so it's worth, as well as them being guidelines, every guideline is a minimum reporting guideline. So all the developers have tried to keep the number to a somewhat manageable number of items. And all of them will say there may be more information you need to provide based on, the type of study you did or different elements. So yeah, they're only ever a minimum reporting, not a maximum.
Yes. Matt, I wasn't familiar with the GRIP reporting checklists.
Yeah. I was working with someone at the moment on an extension for economic evaluations from PRISMA extension, and Sophie's, now I'm not going to attempt Sophie's name, but Sophie led this about 5 years ago, GRIP 2 checklists for improving reporting of PPI. But I think you're right. A lot of the main guidelines that are themselves including a patient and public involvement item within themselves. So yeah.
And that's, I guess it's one of those items that's probably going to become more common across lots of types of research studies, like, you know, like as Matt was saying, in PRISMA 2020, the data sharing item is now in there, and that will become increasingly common across reporting guidelines, regardless of study design, because it's something that all study designs need to do.
Okay. I think we're about on time. So if there are no further questions or comments, then we might actually call it a day. And thank you very much. There will be a recording, by the way. So quite a few people weren't able to attend. So we should have the recording up on the AusRN website probably early next week. Okay. Thanks, everyone.